Good evening, everyone, and thank you for joining us on this webinar this evening on building resilience. We're delighted that it's being presented for us by counselling psychologist Lidia Genovese. I would like to begin this webinar first off with an acknowledgement of country. We would like to acknowledge the traditional owners of the land on which this event is being broadcast, and we thank you for providing access to this part of your country. A little bit of housekeeping before I hand you over to our presenter. We do have you all on mute this evening just to minimise any background noise, but we do want to hear from you. So we encourage you to make use of either the chat box or the question box. Lidia will be presenting and I'll be keeping an eye out on those boxes, and I'll give her a nudge if anything comes through. So that picture that you've got on your screen at the moment is a picture of the dashboard, which you should all be able to see. You might need to have to click on the orange arrow at the top just to expand that box, but hopefully you're all able to see both the question and the chat box. So let's have a quick go of testing the chat box. Now, resilience is a personal journey. So what we would like you to do to start with is to jot down in the chat box what resilience means to you. How do you define resilience? How do you describe resilience? If you don't feel like you're up to that quite yet, maybe you'd like to just in the chat box let us know where you're calling in from this evening, and we'll give you just a few moments to do that. That's great, everybody. Thank you. We saw a few chats coming through. Great to see that we have attendees this evening coming through from the Perth Hills, others from Geraldton and Kununurra. So that's good to see. And also Lidia, our presenter, she's been having a quick look at what's been coming through on the questions in the chat. So no doubt a lot of that stuff will be explored in the webinar this evening.
Hopefully, yes. Interesting that what we have there is generally what the general population would say about resilience. One of the things I'm very glad to see that nobody thinks it's a personality trait.
Yeah, great.
That you're either resilient or you're not.
Okay. Well, before you get too into it, Lidia, I need to formally present you. So, as I said, we're pleased to have counselling psychologist Lidia Genovese with us tonight. Lidia is involved in various committees with the Australian Psychology Society, as well as developing and running training programs for teachers, psychologists, doctors, and other health professionals. Lidia has developed training manuals based on a simplified model of cognitive behavioural principles, and she has also developed professionally produced relaxation and meditation tapes for children, adolescents and adults for stress management and changing behaviour. Lidia enjoys training and mentoring other psychologists and doctors, and is passionate about inspiring people to make positive changes to their lives. So without further ado, it's over to you, Lidia.
Thank you. So, resilience. Well, I have to tell you that I personally probably failed this because as I'm talking to you, I'm getting over the flu. And I think that one of the reasons why I probably succumbed to the flu is because I didn't stop to smell the roses in between all the activities that I'm involved in. And it's about, because resilient is about really how you recharge. And I think I didn't give myself that time to recharge. So, what we are going to try and cover in this 1 hour is we're going to look at what is resilience and what are the challenges of building resilience. Since resilience is something, it's not fixed, of course, and it's something that is ongoing, and you actually can develop it. What are some of the challenges to actually building that resilience? How do we maintain ourselves resilient? And of course, when our resilience seems to go out of the window, do we recognize the signs of burnout? And what happens when we are burned out? So we then hopefully look at ways that we can recharge and power resilience again. So during this hour, though, I don't want it to be a one-way talk. I'd like you to participate as much as possible. So ask questions, and I'll endeavour to try and answer them. Make some comments so that we can have this conversation rather than me just talking at you, so we can talk together. So it was interesting to read what you thought resilience was. And as I said before, I'm really glad that somebody doesn't see resilience as being just being tough or toughing it out, or that it's a trait that people have or don't have. But there is some of that, unfortunately, I think, out in the outback, which is really probably unfortunate, especially for those of us who have worked in the rural areas. So, resilience is about recovering. What do we do to recover from stressful experiences or everyday stress? What do you do? Do we give ourselves the time we need? Or do we see that as a waste of time? And how quickly we can actually bounce back, but not at a diminished level. So let's keep these two things in mind when we talk about resilience. And I'm wondering, what are some of the challenges that you've had to overcome to develop resilience? I mean, I can talk for a long time about some of the challenges that even now, for example, as I said before, not giving myself the time and the space to recover. And so the price that I paid is that I become a lot less resilient to things like the flu. So what do you do? What are some of the challenges for you? So as we talk, just think about that. And perhaps some of you may like to write them in the chat box. And this is for yourself and maybe to help others. So some of the challenges that I think, and probably the most important, is a misguided view of resilience. The idea that we have that actually we need to be tough. And in this world today, when everything's done to cut costs, and we are all expected to do more. For some reason, there is a reservoir there that we need to continuously keep drawing from. However, for us to be able to draw something, we need to put something in it. Yeah, as I'm reading some here, we talk about challenges, and I probably haven't got that one, is demanding managers. Yes, organizations and the demands made by organizations. And of course, as I just said, that we are asked to do more with fewer people. So not enough staff is often a big challenge. And especially in the rural areas where often it is difficult to get staff. The other thing that is a challenge, that often people don't acknowledge the problem. They don't, because it's still often seen that if you're not resilient or that you're vulnerable, that somehow you're weak. So people don't often acknowledge that there is a problem, and that is a big problem. We know that, for example, we are told that in the rural areas, in terms of per capita population, there's less mental health problems. However, I think a lot of it's because there's a lack of acknowledging the problem. It often has much worse consequences than people in the city because it often ends up in suicide. So not acknowledging the problem can become a real big challenge. Time constraints. When you're short staffed, when you have so many things on your plate, finding time to recharge seems to be a waste of time. But in fact, if I think about myself, I've been laid up for 2 weeks, not able to work, and that didn't save any time at all. The other thing is isolation. I think I learned a big lesson many, many years ago. My first appointment, professional appointment, being in the Northwest. I was the most isolated person. I was a school teacher then. I was the most isolated teacher in the state. I had no support. It was my first year out. I didn't know what I was doing. I had no one to go to for support. I had no one to go to for help. There weren't any other teachers around. It was a one-teacher school. I had no one to consult with. And when I think about that, it was probably the year that I really experienced depression and anxiety. That isolation is a killer. Also because generally, you're in country areas, there's a lot of expectations from the community. The other thing is sometimes it's difficult to keep boundaries, and because they're small communities, people expect or they want things from you. You generally only have the local people to be your friends, and things start to get mixed up. So often, instead of visiting a friend, you end up visiting a patient. And that's not good for you. It's not good professionally, but it's not good for you either because instead of having time to recuperate, you're working again. And then, of course, you have to deal with difficult patients, high-risk patients. Now, it doesn't matter whether you're a GP or you're another allied health, whether you're a psychologist, a nurse, and I notice from the population that is listening that there's a variety of mental health of health professionals, allied health, and that's great. And I don't think things are different for anybody when you're out there in the rural areas, because you are on your own and you have to deal with whatever comes your way. Now, most, I think, for example, I'm a psychologist, and part of our system of being a psychologist that I have to have 10 face-to-face hours of peer consultation. And that's part of my professional development each year that APRA actually insists on. And that helps me. That I know that I have to do these 10 hours, and I use that as peer support. In many of your professions out there isn't such a system. You're out there on your own, unless you organize something for yourself. Also, there's a lack of mental health professionals in remote areas, and which means that not just GPs, but most allied health, you're doing a lot of mental health kind of counseling on the side, because people come to mental health professionals, and because if you're a good listener, you'll end up hearing about what's going on in people's lives. And that's often a problem because you don't perhaps have the training to deal with this, and um, there is nobody often to refer these people onto. Um, uh, in helping, we health professionals continuously give. You are there for others. So it's a kind of a one-way system often that you give, and very little comes back. So that in itself becomes a very tiring. Um, and in the end, it's like you've got no more to give. And of course, if you're in the country areas too, and you are with your partner, is your partner happy about being there? Are they engaged? And the other thing that I have noticed myself is that often people in the health professions are seen as privileged people. And in the eyes of some of these people, privileged people don't have problems. So it's almost like you can't go to anyone around you because you're not supposed to have problems. I can see that some of the people are, sending me ideas, which is great, and talking about the ever-changing directions of the work role. And that is true. We are in our society in 2017, the only thing we're really sure of is change. Our roles are changing. And often, not only do we have no training for the changing roles, but there are things added to it that we have to do extra. The other comment that's been made is managing people not performing. Well, that's a very, very stressful thing. And because I do a lot of supervision, I am aware that sometimes, what do you do with these people? Do you just say go away and go and choose to, grow vegetables? You are aware of that, perhaps, this is their career and, this is the way they make their living. And you want to be able to bring them up to scratch, but they often don't meet the expectations of their role and are not performing. And sometimes you think you might be hitting your head against the wall. They are not listening what you have to say for whatever reason. And that's pretty stressful. Somebody's asked me, what things did I cover in peer support? Was it structured? Well, when we have these peer support sessions, we actually can, for myself, I see the other person that I am supporting, that I'm supervising or whatever, as a whole person. So this person has a professional life, but the professional life is done by this human being. And so the well-being of this human being is very important. So I guess that we cover what that person's doing and some of the challenges they're having in what they're doing, but we also cover how they're dealing with these challenges and whether they need more help than, say, a peer can give, and they may need to go and see somebody to sort out some issues in their lives. Or in a lot of time, it's really about support. It's about people going away from the session and feeling stronger and feeling a lot more capable than when they came in. So a lot of it is about helping the person to deal with everyday challenges in their work role, but also maybe in the way that in terms of dealing with other people as well, or whatever it really comes up. So it's generally geared towards work, but the person that is doing the work is the person, and that person may also need, some help. And so that kind of all goes together. Um, so it is structured in the sense that it's supposed to be about challenges that you meet at work, but actually I allow the person who's consulting with me to set the agenda. It is their time and it is about what they need. And I try to fulfill that need. And I hope that answers that question. So, resilience factors. What are some of the factors that help us to be resilient? The first and foremost is a caring, supportive relationships within and outside the family. No matter where you turn around today and look at research, it comes back to relationships. We do have a social brain. It is through relationships that we are nurtured. And so relationships become a very important part in terms of us recharging. Relationships create love and trust, and they offer encouragement and reassurance, and they help bolster a person's resilience. And I guess to some degree, I do some of that in peer consultations. You do have a relationship with the person who's consulting with you, and I mean a professional relationship. But it's a relationship that is safe. No criticism, no put down, no judgment. An offering of encouragement and reassurance, and at the same time, sometimes perhaps confronting with some of the issues that perhaps they need to have a good look at. Other factors is, of course, are you able to make realistic plans and take steps to carry them out? I mean, these are just kind of a common sense things. Do you have a positive view of yourself? Confidence in yourself? How about your communication skills, your problem solving skills? If you are not so good at these areas, you're going to encounter more and more challenges, and it makes it more difficult to stay resilient. And in particular, are you able to manage strong feelings and impulses? Or do you have to act them out? I think emotional regulation of ourselves, being able to regulate ourselves, it's really, really an important factor in helping us stay resilient. Okay, so maybe you haven't done a very good job of staying resilient, not because you're weak, not because you can't. You get so involved in your work. You do too many things. And then you find yourself that you can't get things out of your mind. You keep on seeing pictures or having intrusive thoughts about some of the things you've done during the day. And the ruminations start to just keep going. You might even have some nightmares. You might start to experience a shift in the frame of reference. That is, your view of the world. You become more skeptical. You start to become less trusting. You see people differently. You are more suspicious. You know, if you are a spiritual person, you start to question. You start to question yourself a lot. And you start to question what you're doing. You start to question your beliefs, your relationships. You don't feel safe. You may start to realize that you want to control things a lot more than you did before. And unknowingly, you're kind of feeling out of control. You become less able to be intimate, and your self-esteem starts to take a dive. You seem to become a lot more sensitive to what people say about you, or being able to manage feelings. You find yourself being less tolerant. Or starting to have trouble making decisions. Becoming more cynical and negative. Increased illness. I know that when I allow myself to be run down, that I go too fast at 100 miles an hour, that I end up getting the flu. But all sorts of other illnesses start to appear. For instance, irritable bowel is something that we see quite often. You start to be sloppy in your ethical behavior and boundaries. You take shortcuts. And you know, you may end up being one of those people who, as a health professional, you tell somebody to go home and just take a Panadol. And then something terrible happens. Because you just can't be bothered. Your motivation is reduced. Your enthusiasm for the job you're doing wanes. Do you have any of these symptoms? And there's others, of course, you know, headaches and feeling tired all the time. Starting to withdraw from people. Starting to get a bit anxious. And this is when, unfortunately, we may just go and have another drink. Or take some prescription medication to cope. Where are you at? Are you able to recognize the symptoms of burnout? You know, it happens more often than we would like. I let it happen to me many years ago. I didn't believe it would happen to me. I'm a pretty energetic person. But we all have limits. And especially if you haven't exercised your resilient muscle, burnout might not be far away. Because when you are burnt out, your physical health suffers. You start having difficulty sleeping, get headaches, gastrointestinal disturbances, colds and flus. Emotionally, you start to become very irritable, anxious, depression. Then you feel guilty. And worst of all, a sense of helplessness, which could lead to trauma. Your behavior starts to change also. And you tend to be, your fuse gets shorter. You become more aggressive, callous. You become a pessimist, very defensive, cynical. And the way to cope is to have another drink. I have just had a question here. How do we differentiate between clinical depression and burnout? Well, if I just keep talking about burnout, right? The symptoms themselves may look like depression. I think that what is important is to look at when did this depression start? What triggered the depression? Because some of these symptoms you may experience when you are depressed. However, one of the things that's really distinguished is when you're depressed, you kind of lose motivation for all sorts of things. You don't enjoy life anymore, generally speaking. When you're burned out, what often happens is that you start not liking your job. When the burnout is especially about the job, you notice that when you go to work, you start feeling these symptoms a lot more than when you are at home. When you are depressed, you're generally depressed. Now, people talk about clinical depression. I don't really kind of know if you're talking about all the symptoms, like, for example, feeling suicidal often, not wanting to be with people, wanting to be on your own, feeling always tired, feeling very lonely and alone. I think that if we take a good look at the way that we experience depression, and for everybody's different, by the way, we have a set of symptoms that we talk about, depression, but people really experience depression differently from one another. Burnout is almost like having post-traumatic stress disorder in the sense that it kind of has an alarm system throughout the body. As a matter of fact, some of the symptoms here, perhaps I probably should have put up there, is that, and I have met that in my workplace as well, as I have seen many people who ended up burned out. And another added symptom here is that they start to feel unsafe in the world. And they start to have a startle response. They start the nightmares and the flashbacks and the ruminations that kind of go on. These are things that you don't necessarily see in depression. People who are depressed may either not be able to sleep or may want to sleep a lot of the time. So the thing that you don't have with depression, it stands out with burnout, is actually the brain seems to be stuck. It's a bit like trauma. The brain seems to be stuck at the place where they felt stressed or helpless. So, as I said before, and when I talked about symptoms, um, the physical health, sleep, headaches, gastrointestinal disturbance, and I haven't talked about it in terms of kind of almost being traumatized. And I haven't done that on purpose because I think sometimes with burnout, I have seen that people have similar symptoms to post-traumatic stress disorder, um, and it's got to do with their workplace or something that happened in their workplace. So I've kind of left that out because I don't. This is not so for everybody. But it's often one way that you can tell the difference. And generally, it is about um, the fact that you can't sleep is because you keep on, your brain goes back to situations, things that have happened that you either couldn't do anything about or you got into trouble for or something inappropriate happened. So it's like in a burnout, it's like your brain is stuck somewhere and it's hard to get it unstuck and bring it in the present. Depression it is about the past, but you don't have you don't have the flashbacks that you often do with burnout. You don't have the nightmares that you do with burnout. It's not often specific in terms of it can be specific in terms of what cause if it's just situational. So you may be thinking about that particular thing. I'm kind of I'm not having. Yes, I am having some difficulties in kind of making it clear. Um, how do you know the difference between the two? I think you do because when you are burnt out, you do tend to um, have something to do with the workplace or whatever it was that you were doing that actually has caused you to be burned out. It is in a way trauma, but not trauma in the full sense. So I think if you just think of it in terms that if you don't have those nightmares, those flashbacks, those constant rumination about a particular thing, and it's specifically related to um, to a situation, is that you probably general depression. Well, there's a kind of people who get depressed. There's generally some kind of history too about personal stuff, and of course you can be depressed about things that happened at work. But I think you would know the difference. So I don't know if I've explained it very well, um, but this is from the top of my head. But I certainly have seen many of both, and the people can tell the difference between being burned out and just being depressed. So, and in a way, if you have depression for whatever reason, um, building resilience won't hurt. It can actually help a lot with whether it's depression or anxiety. So, building resilience is a personal journey. And for everybody, it is different. What is traumatic for one person may not be for another. And also, we need to take cultural differences in consideration, how we react to things. Because on one hand, resilience is in response to things that happen in the environment, but it's really how do we respond to these things that affects how resilient we're going to be. So some of these things are quite personal in terms of the way we interpret things, while others are quite general. So let's think about resilience as if we have a resilience muscle. And in order for us to keep this muscle fit and strong, we need to keep on exercising it. Now, fortunately or unfortunately, whichever way, but I think it's fortunately, exercising the resilience muscle should be a pleasure. It should be activating the parasympathetic nervous system. So, what can we do to strengthen the resilience muscle? As we talked earlier, the most important thing is make connections. We have a social brain. We survive better when we're in a tribe. And one of the things about being out in the bush somewhere is that often we don't have enough people that we want to make connections with. So do you make the time to do the things you enjoy doing? Or is it, like you do time management and, you do the things that you have to do every day, and then you take care of putting out all the fires that you have to do every day, and then you do the things that need to be done, and then there is no time for you. So do you make time to do the things you enjoy doing? Because when you make that time and you do the things you enjoy doing, you're exercising that resilience muscle because your parasympathetic system is working. Now, get to know yourself. Look for opportunities for self-discovery. I think if I hadn't done that in my life, I probably would have gone into burnout again. Now, for me, it happened about early 80s, quite a long time ago. But from that, I took the opportunity to get to know me. Are you a perfectionist? You see, I had to be very clever. Now, you can't always be clever. And you can't be a perfectionist, full stop. Now, sometimes if you're a doctor, I'm glad if you're a perfectionist for me as your patient. But for you, it's not a good thing. Perfectionism is a recipe for anxiety. What about your view about mental health? Do you think about being crazy, or do you see your brain as another organ? If your heart was in trouble, you'd have no trouble going to see someone about it. If your liver is in trouble, you'd have no problem. What about your brain? What if that isn't functioning in a way that it could? Would you go and see somebody about that? Would you seek help if you notice a shift in your state of mind that persisted for more than a month? Do you take advantage of the many sporting opportunities that rural communities and contexts offer? I remember being sent to Kalgoorlie many, many years ago as a psychologist. And for the first 4 months, it was a very, very lonely experience. Even though I was in a school, I was the only psychologist in the school. And in a way, I couldn't communicate the kind of things that I would like to communicate to another psychologist. And one of the things that changed was I joined a sporting group. I started to go back and play hockey. And that kind of changed the whole way that I lived in that community, which was great. I became part of that community. Rural communities have many people with hidden talents, particularly in the realm of arts. You'd just be surprised what lies quietly within a rural community. Do you have a standard response or responses ready when you're asked about private matters or a patient, for example? Oh, you so-and-so. Okay, what did I come to see you for? Or I noticed yesterday somebody, came to see you. Is Mr. So-and-so still seeing you? Do you have a standard answer that, like, oh, really? Thanks for telling me. Do you have one that you don't need to justify or spend time thinking about answering that kind of question? So how involved are you in the community? And do you exercise regularly? It's really another important. I have a friend of mine that's a nurse in a rural community, and she has actually bought a dog. So now she's got an excuse to go walking every day. And for her, it became a really important thing to have a dog. And of course, what happened? She started walking her dog. She started to meet other people walking their dog. And interesting things start to happen. So exercise, find a way, exercise. It builds serotonin. Right, this is very important, and I have one of these. Do you have an interpersonal support for close friendship? As you're reading it there, rate it. On a scale from 1 to 10, you know, do you have someone that you share problems with, that you play with? Someone for expert advice. And I know that in the country areas, often that's very difficult. But we've got Skype. We got FaceTime. We can find ways. Excuse me, that's part of my flu. Do you have someone that helps you to energize? A teacher, a mentor. You know, when I left university after I did my master's, the person that supervised me was my mentor, and unfortunately he died a couple of years ago. But it was great whenever I was in real turmoil or I needed to make a decision, that he was always there. That gave me such sense of safety. Do you have someone that you can go to for acceptance and approval? Do you have someone to help you discover and try new things? For a good social time? Do you have someone to go to when you're hurting? This is probably the most important thing you can do to exercise that resilience muscle. If you don't have this, do something about it. So, as I said earlier, this is relevant for everybody. We all need to find peace of mind. What personal approach do you have to calm your mind? You know, your mind is highly involved in this resilience. Your body needs to be fit and healthy. Eat well, you sleep. But your mind needs to be also calm, peaceful. Can you be with an empty mind? If you have peak hour traffic in your head, you need to talk to someone. It's another sign of burnout. So, I'm going to leave 5 minutes for questions. We have some. So, take home message. Find time to smell the roses. Give yourself permission to recover from stressful situations or work demands. The resilience muscle is exercised when the parasympathetic nervous system is online. So keep that online for as long as you can. And I know that there are many challenges, and some of them, unfortunately, we have no control over. And they're the worst kind, because the minute we start to feel helpless, burnout finds its way in. Being helpless is not a good survival technique. However, there are so many things today. There are so many expectations that unfortunately there are times we do feel like that. And if you do, talk to someone. From today, make time to relax and play in between meeting your obligations. And if you have difficulties in playing, you know you're in trouble. Go talk to someone and exercise that resilience muscle. So, I'm giving 5 minutes before we end for anybody who's got any questions, any observations, any comments that they wish to make, anything they want to clarify.
I'll read this question to you, Lidia.
Yeah, please.
If you are in a position to support rural or isolated staff, what are some tips?
I suppose, in a way, it kind of. Are we talking about one-to-one? I actually supervise quite a few psychologists out in the, rural areas, and I listen. Important, listen. And if they need help in what they're doing, then give them the help that they need. But in particular, what is really important is to acknowledge, to accept, to encourage, to make the person feel that they are doing the best they can. And explore, really, whether they are exercising their resilience muscle. What are they doing to take care of themselves? Support self-care. Sometimes they need us as supervisors or peer support, to help them in their, in some of the challenges that are happening at work. And sometimes there are no answers. And sometimes we have to help people to just accept things as they are. We can't always change what we want to change. So the most important thing, and I know that this is the most important thing that I do, is to listen, acknowledge, and most of all, make people feel important, make them feel that they matter, because in the end, what we all want is to feel that whatever it is we're doing and who we are, somebody cares enough about us to acknowledge us, to accept us, to validate what we feel. There are no wrong feelings. And to help us to perhaps come to terms with some of the issue that may come up, and to notice what can be changed, and to learn to accept and find ways around the things that can be changed. But in particular, the support is about making the person going away feeling stronger and important and capable.
Thanks, Lidia. It's close on 8 o'clock now, but we're happy to hang around for another 5 minutes because we've got a couple of more questions here that Lydia's still happy to answer. But for those of you who do want to sign off now, thank you very much for participating this evening. Thank you to Lidia for sharing the information and for sharing your personal stories too. We have recorded this evening's webinar, so if you want to come back and listen to it again, or if you want to pass it on to one of your colleagues, we'll be posting it up on the Rural Health website soon. But yes, just to go on with a couple more questions.
Yeah,
go ahead. To read it?
Yes, I can't read from here. This is what happens when you get old.
The question here, Lydia, one of our participants is asking if you think doctors and health professionals should have regular peer-to-peer mentorship, perhaps 2 to 3 monthly meetings to make sure that they can identify early the signs of burnout and how to put change in place before it becomes more of a problem.
I definitely think so. And I think 2 to 3 months is probably a long time. I think that what we do as psychologists, having 10 sessions a year, and that's part of our registration, you might at least have it bi-monthly. But I think it's really, really important to have these things, because sometimes people suffer in silence. And by the time it's picked up, that person is in real trouble. So I think it would be really, really important. And I do notice, every time that I run a workshop with doctors, the same thing comes up. Having some peer consultation, supervision, either on a one-on-one, one-to-one, or in a small group. But it has to be a place where people feel safe, where they can say what they need to say, show themselves where they're at, without the fear of either being reported, or there has to be this very confidential kind of agreement. But I think it's really, really important that that happens. And in particular, for people out in the sticks somewhere, that it is possible to meet every bi-monthly with a small group of other professionals. And we don't necessarily have to be all doctors or nurses or whatever. We've trialed things. We have a peers evening, and all different professionals come. And I think, 2 or 3 people together could, it could really help each other a heck of a lot. As you can see, a lot of the issues are not about the actual job, but it's a lot of the issues is how the job is affecting us. And so I think that would be a really, really important thing to do.
And Lydia, maybe we can wrap up quickly with this final question from one of the participants. She is after some tips on getting on with a work colleague who is very negative all the time. And it sounds like that same colleague is not a good communicator either.
Right. This is always very, very difficult, because people like that, if you try and come at them directly, they'll won't acknowledge it, that there is a problem. When somebody says, no, I don't have a problem, it's almost that you have to do it in behavioral kind of way. Look at some of the things that they've actually done or have said, and also be very careful that often when people are at that burnout stage, they do tend to kind of try and blame something else rather than look at what they're doing. They're not very open to self-discovery. So one of the things that I often used to do, if they had a complaint, I would say, put it in writing. I won't do anything if it's not put in writing. I would kind of look at their behavior, and I would then go in terms of either what they've actually said and what they've actually done. You can't talk to these people in terms like you're not being very kind, because you can't define it. It's got to be behavioral. It's got to be so you can show it to them. And if possible, to have somebody else with you, so the other person doesn't say, well, you're making it up, or finds an excuse. And so what I often found was that in order to get the person to become aware, I had to actually show something they did, they said, that I could actually kind of almost put it on paper. It's concrete. You can't go to these people and talk in terms of you're not very nice to people, you're not a good communicator. It doesn't mean anything. You've got to then give concrete examples of their behavior. That's what I found to be most useful. Without blame, there's no need to blame. It's like when you do this and you say this is what happens. Have you thought about that? And if it's 1 or 2 or 3 people that say these things, you'll be surprised just how, that person might get the message. But it's very hard to be, in a situation with someone like that. So, yeah, you can't just say, oh, you're becoming callous. You have to say, look what you said. So I hope that's helpful.
Yeah, great. All right. Well, thanks to those who hung around that little bit longer just to get those last bit of tidbits. And we will sign off now. So once again, thanks for everyone.
Yeah.
And hopefully we can repeat another webinar
Yeah.
with Lydia's expertise sometime in the future.
Thank you very much. I enjoyed this little chat, conversation with you, and I hope that it was helpful. Yes, I hope that we do some other things in the future. Maybe people can say what they would like. Maybe people can express.
We'll leave the chat box or the question box running for the next 5 minutes, so we'll tune out ourselves. But yeah, any other comments, leave them in the question box.
Thank you.
All. Have a good night.
Yeah, thank you.